Okay.
You see it? Click the arrow, click the sharing settings.
Yeah, multiple participants can share simultaneously.
Well, both of those and share it all. I think there's two.
Yeah. Okay. So I clicked that. Courtney, do you want to test and throw your slides up for 1 second and see before I do your introduction?
Yay.
Yep, I think there we go.
Okay, perfect. Courtney L. Edgar, LPC, NCC, CAADC, and CCS, is a clinical mental health counselor and clinical supervisor. Her specialty areas of practice include substance use disorders and medication-assisted treatment, AccuDetox, trauma-informed care, auditing and compliance, and clinical supervision. Courtney has a passion for fostering mental health and wellness in clients and has used this as the cornerstone for her professional practice with children, adolescents, and adults. In her current role with the engagement team at LifeWays, she is bringing this passion to the community by leading a team of clinicians and peer support specialists who help consumers become connected to mental health services by removing barriers that may prevent participation in treatment. And so I turn it over to Courtney.
Okay, thank you so much. So the presentation here is going to be focusing on the specific team that we have here at LifeWays called the engagement team, as Dion mentioned a little bit. We are primarily focused on removing barriers in the community and promoting mental health and wellness. So we thought that was the perfect title for, our presentation that we like to use. So, the first thing you might probably be asking yourself, what is the engagement team? What exactly is this group of people? So basically, we are what we like to call access on the road. So we have our access department who takes care of the intake assessments for the consumers who come into LifeWays, and they do the intake, get them connected to services. But LifeWays started to think, what exactly do we do with those consumers who maybe can't come into the office? What if they've got, some barriers coming up there? What do we do with that? So they created the engagement team. So we actually take that intake process to them. So we remove barriers that can prevent someone from getting started with their services. We provide emotional support until individuals attend their official first service provider appointment. So once they're connected with their case manager or outpatient therapist or something like that, we help support them all the way through that process because they may have additional barriers that prevent them from being able to, keep coming to some of those appointments. In order to reach those consumers, we will partner with local organizations and we facilitate mental health and wellness support groups. Again, we take all of those things and we take it to those locations so people don't have to come to us. We will go to them. And the last thing that we do is we will help our existing consumers stay engaged in their services if they experience some kind of barrier. So if someone's in treatment and they start to have some transportation issues and they're at risk of possibly losing the services here, we go out and we try to help with those barriers. We try to help find a way to get them re-engaged so they can continue with their mental health treatment. This is our team, this beautiful bunch of humans that you see in front of you on the screen. We have myself as the current engagement team supervisor. We have two clinicians, Laura Smith and Taylor Owens. And then we have two peer support specialists, Clarissa Winters and Sherry Mills. Our peer support specialists, they are actually both certified. So they are certified peer support specialists. They are just too modest to allow me to put that on the screen specifically. So I wanted to make sure that that achievement that they have earned is recognized as well, because it takes a lot of work to get any sort of certificate, as I'm sure everyone here probably knows is a lot of work. So I want that to be recognized for them. So basically, a peer support specialist. If I'm being completely honest, I wasn't really that familiar with what exactly peer support specialists do when I first came to LifeWays. So it was kind of a really new experience for me. And it's actually been something that I have found really cool, and it can really help the process. So basically, the peer support specialists, or again, our certified peer support specialists, they are someone who has lived experience of a mental health condition and or a substance use disorder. They are in recovery and they want to assist others in their own recovery journey. So essentially, peers are an invaluable resource. They are so important into the process because they can really talk with someone, not just from that empathy perspective of, I can imagine what that would be like. They can actually say, I know what that's like because they've been through some very similar things before. They are able to provide emotional support. And the unique thing with our peer support specialists, it is short term. And that allows them to get that assistance from that initial intake appointment to that first service appointment. And it gives them some of that emotional support to help keep them motivated to come to that appointment. And their main goal is to empower the consumers and to empower individuals to engage in mental health care services. They also conduct screenings. And this is one of the most important parts of identifying those barriers because they conduct social determinants of health. It's a special screening that's actually on the Care Hub, which I'll kind of talk a little bit about towards the end. And ultimately, the social determinants of health looks at conditions in someone's environment, which is, the environment where they're born, they live, where they work, where they play, where they worship, all the different kinds of things that happen in the environment that could affect someone's life. So they do screenings to help identify those barriers. But the beautiful thing, not only do we identify those barriers, we figure out ways to solve those barriers or to make them more achievable so it's not preventing them from having access to mental health care. And the last thing that our peers do, they facilitate support groups out in the community. So they are running additional support, even if consumers are not actively involved specifically with LifeWays. We have support groups that we offer. That brings us then to our clinicians. And our clinicians we are either licensed counselors or licensed social workers in the state of Michigan. And we complete the initial assessment. That's part of our LifeWays process. So we are the ones that sometimes our clinicians don't get to have as much fun because we have to ask them all those hard questions about their life to try to help understand what they're going through to get them set up with the best services for them. We then provide them with those treatment recommendations. And then we also do community outreach. So we will partner with some different organizations in the community and help those organizations learn, kind of like some tips and tricks on how to talk with their consumers or their clients or, their customers or individuals about mental health care. So it gives everyone a sense of empowerment on how you can talk about the subject and also letting people know it's okay to talk about this kind of thing. So basically, we base everything off of Maslow's hierarchy of needs. So it's kind of from the standpoint that if we have someone, that maybe they are struggling with, where they're going to stay for the night, they are struggling with, where to find food or clothing, or they're not sure if they have, that personal security and if they're going to be in a safe place. If they have some of those barriers coming up in the way, they may not be as much focused on some of their mental health care needs, strictly because those base needs take over. So we help to identify some of those lower sections of that pyramid to help get someone to a place where they can engage in mental health services and hopefully continue moving up that pyramid to really have the best sort of life that they are wanting. This is not a comprehensive list under any circumstances, and everyone here can probably identify a solid, many more barriers. But typically the barriers we most find, there's not reliable transportation. And sometimes it goes just beyond having a car. You might not know how to, read the bus route. Might not even know where those bus stops are. If I didn't have my car and didn't have the ability to, use Lyft or Uber or something like that, I wouldn't know how to use the bus system. So that would be a huge barrier that would have to be overcome. Finances, definitely any sort of finances is a huge barrier we see. A lot of times we see schedule conflicts. So some people may need those evening appointments. If a business closes at 5, makes it kind of hard if they have to work. They then sometimes get put in that hard spot of choosing which one they are going to go for. And that's a horrible spot to be in, trying to choose work and providing for yourself and maybe a family, or taking care of mental health. Like that's an impossible spot to be in. Loss of social and emotional support. So, social isolation, lack of friends, lack of family support, prior struggles with mental health treatment, lack of information or the resources about available services, simply just not knowing what's out there. There can be ambivalence about readiness to start services. And then there can also be stigma due to receiving help and having mental health concerns. One of the biggest challenges here in Jackson specifically, LifeWays is located on a really busy, popular street. Anyone driving by can possibly see people walking in. So people could feel, scared or hesitant, not wanting other people to know that maybe they are getting services somewhere. So that's a huge thing, which is why we, as the engagement team, try to go out into that community so that maybe people don't need to worry about that. At the current time, the engagement team is focusing on 5 primary priority populations. And these are individuals recently released from inpatient mental health services or the jail, individuals with substance use and abuse disorders, individuals experience homelessness, the serious mental illness, serious emotional disturbance, intellectual disability, and developmental disability. So that's individuals with, SMI, SED, ID, and DD, and then also transitional youth. And I'll focus on a few of these to give you a better idea of how we're helping these populations. So the first one that we have is substance use disorders. We consider this a priority population. And the reason this is such a priority population is because there are very unique needs that happen when someone is experiencing a substance use disorder. Unfortunately, sometimes people can kind of fall through the cracks during the wait time to get into services. They may not know what services are available to them. They might not know if they're eligible for, detox, inpatient, individual, IOP, intensive outpatient services. They might not know. So we help to engage in what is, it is called case finding. So we have special referrals, and the nickname SARF referrals, but it looks at the screening, the assessment, the referral, and the follow-up. So when anyone contacts LifeWays and they identify having a substance use issue of any kind, we do a brief screening. That brief screening automatically pops us with some treatment recommendations that the individual could have. So we will refer people to those services, and then that's when the engagement team comes in. The engagement team will reach out to that individual within 2 business days to follow up with them, to be like, hey, has that other place contacted you? Have you been able to contact that other place? If not, would you like us to help you? We can meet you and we can make some of those calls together. So we continue to have that emotional support and reach out to them so that they can be successful in their treatment. One of the current partnerships that we actually have is with Andy's Place. So I keep wanting to say Andy's Place again. So the engagement team will be going to Andy's Place starting, I believe, on May 12th, once a week. We'll be there for a couple hours doing screenings, talking with individuals about mental health, giving them access to some different types of services that LifeWays offers, and also other services that they may be eligible for out in the community. So again, we're trying to take our services and our team to the people. And I know I see a couple chat things in there, but I can't actually see them with the share screen. So I might have to address those at the end.
No problem, Courtney, this is Dion. I was just reminding people that different ways that they could interact and ask questions.
Okay, yes, thank you. One of our other priority populations is individuals experience homelessness. And this definitely hits that bottom part of that Maslow hierarchy. So it really looks at that, well, the bottom 2, it looks at that safety and it looks strictly at shelter. So what we do is very similar to the partnership we will have with Andy's Place. We have a current active partnership with the Interfaith Shelter. And at the Interfaith Shelter, we are there every Thursday from 9 until 3. Some of the team is actually over there right now. And our clinicians are doing screenings with individuals to get them scheduled for an assessment. They're connecting them with those peers so that they can help start looking at what their barriers are and how we can help. And then we also partner with the Interfaith Shelter to do some additional groups with them. And some of the groups have been put on by other other departments here at LifeWays. We recently did a spring break event where we just kind of, our team talked with the kiddos staying at Interfaith Shelter about, mental health and, some little coping skills in a fun way where they're learning so much, but they don't quite know that they're learning. One of the huge priority populations that's a little bit newer for our team is working with transitional youth. And when I first heard this, I really didn't know what transitional youth was. The more the team started to look into it, the more we realized there's a lot of different definitions and a lot of different individuals that are considered transitional youth. And so one of our missions is to be able to educate people on what transitional youth means. And that's exactly what we have this slide for, where someone who is a transitional youth can be considered, a child who's run away, children with emotional disturbance at risk of expulsion, foster care placement, and they're at risk of homelessness because they age out of the foster care system and they're no longer eligible for those services. Also, it's youth who age out of several different things. So youth who become too old to be involved in the children's waiver program or the children's special health care services plan. It is. Oh. Is my screen on for the share screening?
Yes, your video isn't on if you wanted to show your face.
Okay. So we have, the other thing that we typically have is the DSM diagnoses for children. Some of those diagnoses, they can stay with someone as they continue to age out. Others, sometimes they age out of those diagnoses. So then it leaves someone in a really unique position of what happens then. So that's why we have the DSM diagnoses that they age out of as part of transitional youth. So that also then leads us to, so where's the engagement team come in then when it comes to the transitional youth? And our primary purpose for that is to connect individuals to referrals for specialized services. So again, we do the exact same process that we do for all the others, where we identify barriers, and we also provide support for unique stressors that they may be going through. And we do that by some of, some of those unique stressors could be mental health, guardianship, food stamps. So we help provide that support to both the individual who is the transitional youth going through this, but also to their families that are going through this right along, right there with them. There we go. Trying to make sure it got all the screen on there. So one of the other things that we have that goes with our team is the process itself. And you've heard me reference a few of these things already, but what we have and what we start with is the screening. So they do that access screening where we just kind of get some basic information from them, which then allows us to schedule them for that intake. That's when the clinicians will take over and do that formal assessment with them and be able to figure out what exactly is some of those best services for them. Then they get to kind of transition right over to the peer support specialist for the identification of barriers. And again, that peer support specialist, or our certified peer support specialist, they help break down and solve those barriers that the individual may have that can prevent them from going to that first service appointment. I think I have to hit that one again. There we go. So the services at LifeWays. We offer a lot of different services. When we do the assessment as clinicians, we look at what the individual may need, what they may qualify for. We give recommendations, and then we kind of talk with the individual about what would be most appropriate for them based on what they need. Some of these things include ACT, home-based services, MST, outpatient therapy, and we do have a substance use department. So we have mental health counseling that we can do. We have substance use counseling. And then we also have, that co-occurring that we can do as well. We have our case management side. We also can connect people with resources to ABA. And we also have services for psychiatric and med services. We also have health and wellness, so like our integrated health department, and we have our crisis services. So we have lots of different kinds of services here that can help with a lot of different things with a lot of different stages of life. So you know about the engagement team and what we do, but now let's kind of talk about how you can possibly refer someone to the engagement team to get them some of that additional support. So LifeWays is now what we call a CCBHC grantee, and that means we are a certified community behavioral health clinic. There's a lot that goes into CCBHC, but just very basic part about it is we are able to accept individuals that with their stressors and mental health conditions may be mild to moderate, and also that moderate to severe. So we can serve a very, very wide variety of people with a lot of different situations and issues that they may be experiencing. I referenced the Care Hub a little bit earlier, and the Care Hub is a very useful source that's kind of a little bit like 211, where it can help identify some of those barriers, but it can help someone become connected to the resources to help them with those barriers. And I know our certified peer support specialists use that here. And we also have our community health workers at LifeWays that will use the Care Hub to help refer people to some different services as well. The other thing that you are able to do to refer someone directly to our engagement team, you can reach out to me. And I have my email and phone number on there. And the thing that we do ask is when you kind of send someone our way with a referral, just making sure that that individual is on board with it as well. Because we don't ever want to ambush someone and push them into services that maybe they're not quite ready yet for because of that barrier of ambivalence. So we just want to make sure that they're on board, and we'll kind of reach out and we'll be able to help them from there. We do not have a specific slide about our support groups, mainly because our support groups are changing all the time to best help the needs of the community. Right now, we have a community connections support group that we have over in Hillsdale. And that is a new support group that is actually going to be starting this upcoming Monday on the 9th at 10 a.m. I'll throw that out there. And this is a support group that's designed to really look at some of the barriers that come with Hillsdale being a smaller community. They don't have as many resources immediately available to them right there. So it puts essentially a barrier in place because of, possibly where they live. So we are developing a support group to help people who are experiencing that, because it can be really hard to know you want something, but not fully be able to actually access some of that. Our other support group at the moment is actually with Reed Manor. And we also have a partnership with Reed Manor where we are there once a week doing a support group and also doing screenings. And this support group focuses mainly on mental health and wellness, specifically with the aspect of housing and housing challenges and some of the challenges people may encounter with low-income housing, and just trying to provide support to them, and also giving some assistance to the staff members at Reed Manor on how they can better understand some of the challenges that people may go through, and giving them support and the confidence to discuss mental health with the residents there when we're not. So in short, that is all I had for the formal part of the presentation. And I wanted to make sure that I left time for questions. So I'm going to go ahead and do an actual stop share. I think it's going to let me do it. There we go.
Courtney, it's
Yes.
Dion. I do have a quick question that I thought
Yes.
of. When referrals are given, do
Mhm.
you want the service provider to contact you with the consumer's name, or do you want the service provider to give the information to the consumer and have them contact you directly?
Honestly, we have some partnerships that will use either one. Sometimes they will just give the individual that information and they will contact us. Other times, the individual will call with whoever's referring them. So sometimes we also have the other side where the individual gets the referral. They don't want to really be a part of it, but they agree. So the actual referral person gives them gives us the information on behalf of them. So it's kind of a lot of different ways. There's not one specific thing that we have.
Okay, great. Thank you. There's another question in the chat. Are you familiar with Duchess too? They work with at-risk youth in Jackson, Hillsdale, and Lenawee counties. I just gave up the fact that I'm not from Michigan. Or they did prior to the pandemic.
Yeah, to be completely honest, I'm not super familiar with that. I have heard of them, but I'm not exactly completely sure, to be honest. I will have to look into that a little bit more.
I think their offices are either near you or in the same strip, Duchess, and they primarily work with at risk of homelessness or in homelessness youth. So that might be a really good connection to get.
Oh yeah, definitely. Yeah. And that's also why LifeWays loves doing these types of presentations because we have 20 people in the community on this presentation group right now. And it's just a great way to be able to have, resources being shared.
There's another question. What is the criteria for a client to be eligible for the engagement team's services?
That is actually a really great question. And the answer to that is pretty much anybody who wants to receive mental health services.
In Jackson or Hillsdale County.
In Jackson or Hillsdale County. If someone calls and they aren't a resident of Jackson and Hillsdale County, we will still be able to connect them to their local CMH provider. So we don't just kind of be like, oh, sorry, we can't help you. We definitely make sure that they have all of that information that they need. And a lot of times we will offer to help them call that CMH to be able to have more of a warm handoff and that smooth transfer for them.
Courtney, it used to be that to access those kind of services, clients had to have Medicaid. I understand that's changed with your presentation and a previous presentation. Can you update us a little bit more on that?
Yeah, it used to kind of be a thing in the past where it was more times than not, an individual who came here had Medicaid. Things have changed now. We have a lot more providers who are paneled with a wide variety of different insurances through like private insurances. So that allows us to be able to provide services to some people that have the private insurances. So yeah, so it's a lot different now. So it's actually really cool to see the transitions.
Can you also connect with like our youth that have no insurance?
Yes, we can also work with that as well. And that's part of where some of our additional funding comes with, being part of that CCBHC grantee, some millage funding. So we have a lot more options. So individuals who maybe don't have insurance, they're not completely excluded anymore. And I see there, it looks like there is also another question. I want to make sure that doesn't get missed. In the past, there's been excessively long wait time to get into therapy. What is the average wait time for therapy services after approval? With everything, there may be a little bit of a wait as well. With us, I think right now it might be, I'm trying to remember, when looking at the schedule, I think it might sometimes be around, for therapy, it's probably around maybe about 3 to 4 weeks, and we try to get it in even sooner than that. But that's also why our certified peer support specialists have kind of been put into play, because as they're waiting for that first service appointment, those peers can continue to check in with them with their needs. They can continue to give them that emotional support. So it allows them to be able to have some support, so they're not just solely on their own when they wait for that appointment.
There's also the provider network, as a former LifeWays employee.
Yep.
You don't have to have a LifeWays therapist either. Once you go through that access, you can choose to use another provider network.
Yes, and that is something that we also have, where we are able to look up all those different services that are involved. So if someone wants outpatient therapy, we can pull it up, and our electronic medical record system is fantastic. It'll pull up the available appointments that Integro has. It'll pull up what Segway has. It'll pull up sometimes recovery technology. It'll pull those up as well. So we are able to see that very easily. And then we can also give someone that treatment preference on, yeah, they might have to go through us initially for some of that connection, but if they want to go to Integro or they want Segway, we can help them get to that. So just because they come here for that intake doesn't mean they have to stay with LifeWays itself. They can go to some of the others some of the other service providers we have as well.
Is,
Oh, go ahead.
sorry. Is virtual therapy also an option still?
Yes and no. I do know a lot of that is based in large part from some of the COVID guidelines and the COVID recommendations. A lot of it also goes into the comfort level of the therapist. And after meeting with the individual, whether the therapist feels that that would be an appropriate thing for them. So if we're still able to with COVID guidelines, and if the therapist feels that it is appropriate, it is something that we can definitely offer.
I want to interject in here real quick. I've posted the link for the CEUs for this session. So remember that to receive CEUs, you need to fill out that form and also have been in the session the entire time.
Any other questions anyone has that they can think of? Or even just any other resources that someone has that they'd like to share for everyone in the group?
Are there any upcoming community events that the LifeWays engagement team is planning on attending or participating in the near future that we could pass along to people who are kind of on the fence?
Yes, right now we will be having an event specifically for the residents at Andy's Place that will be coming up on the 12th. And that's to kind of help, for their residents announce our partnership. But we also have it will be in partnership with Reed Manor on May 17th. They are having a mental health awareness event for their residents as well. And it's going to be something that we kind of have some additional information about LifeWays and the services. And it's got some additional information when it comes to, the engagement team specifically. And we're also going to be doing a lot more out in Hillsdale. We're super excited to be able to help bring some additional things over to Hillsdale. And I don't think there is an exact date yet, but I do know there is an event we are going to be a part of this summer. Part of it has not been formally announced, but there is going to be an upcoming summer event that has a lot of mental health awareness that we're going to be a part of as well. So we do as much as we can, and we're always looking for new places.
I was going to mention, if we have places that you might want to have a booth, have a presence, should we get a hold of you?
Yes, definitely. Yep.
There's another question. Any idea or guess on how long the current wait is for pediatric psychiatric services?
I see Shannon's in the room. Is that a Shannon question?
For a new person?
Sounds right.
So we have two current psychiatrists that see children. We have one starting in June. And so I know it is a couple weeks wait. And I know that for new consumers, they try to triage and prioritize them to get them into the slots as they open up. So I would say for sure a couple weeks that will probably speed up with the new doctor coming on in June. All of the services are provided through telehealth.
So yes, thank you for the assistance with that, because I was going to have to look into that and get back with people on that, because I'm not completely familiar with some of that.
Yeah, I would say the most difficult part really right now is, of course, parents not wanting to take the children out of school. So We have had at least one doctor who has done some later in the day appointments, kind of after that 5 o'clock period. And then when summertime comes, it will open up a lot more slots because kids will have some more availability during the day. We can get you some more accurate information if you'd like, but I would say 2 to 3 weeks.
Thank you. Sounds good.
So Tammy Dotson put in the chat that she's currently in the process of creating a community living room at the library and would love to have some partners come in to ask questions for the community.
Oh yeah, that would be amazing. Yes, that could be that. Oh, that's going to be a huge thing for the community. Oh, that's awesome.
Any more questions, comments? You can do it verbally. Sharon Elliott is extra excited that you're bringing more services and resources to Hillsdale. And a reminder, I'll post it again, the link for CEUs.
And I can
And-
remind the
Go ahead.
the after email of the whole session, we will have an evaluation of the whole day of the event. And these are all being recorded. So if you missed one, you'll get a link to where those are going to be posted.
And we get a thank you or an applause, a clapping thing for Courtney for her great presentation.
And I did pop some of my contact information in the chat as well, so you have it a little bit since it was only on the slide for a few seconds probably. So I popped that in the chat as well for you.
Thank you.
But yes, thank you so much for coming to this presentation to kind of learn about the engagement team and some of the really awesome things that we have going right now at LifeWays.
All right. Now go get your Cinco de Mayo tacos.
That's the real reason why it got quiet. People are looking at their watches going, I can hit happy hour in like just a few hours. Thank you, everybody.
All right.
Yes, thank you.
Enjoy your weekend.